Hi, Lisa, can you hear me?
Yes, I can hear you. And Grant, I think I double admitted you. I don't know.
Wow, that makes me feel twice as special.
Yeah, there you go. Hi,
And then
Julia.
I don't know if you saw the email, but Monica said she has to hop off at
I
4:15.
saw that. Yep. I
Hi,
think
Randy.
we'll be okay. Hi, Linda.
Hi.
Hey, Monica.
Lisa, is there any way to save that recording to my computer, or do we always have to go out to the county site to look at it? The recording of the last meeting.
I don't know if from YouTube there's a way to save it, but Monica, can I send her a copy of it?
Yeah, you can send a copy. You might check with Teresa too. She might know whether or not I don't know if you can download from YouTube to your computer, because if you're able to download it, then you would be able to save it, I think.
Yeah, I think it depends on what settings you put on your account. And so I could ask Jen also probably what settings they have on the account for downloading. But I can just send you want last month's, and then I can figure that out in the meantime.
Okay. Yeah.
Did you want, it was just last month's that you want a copy
Yeah,
of?
or I guess if it's always on the county site, we could just go out there and look at it.
Yeah, it
Would
should be
all-
there indefinitely.
Indefinitely. Okay, that's fine.
Yeah.
That's fine.
Well, we don't have very many people here. I'm going to wait a couple more minutes and see if we get some more people pop in here. As it sits.
I do keep trying to admit Miranda, so I think that will give you 5. 1, 2, 3, 4,
She
5.
would give us a quorum. Oh, there she is. I see her. Okay.
I'm here. Can you hear me?
Yes.
Okay,
Okay.
perfect. I just have really bad reception, so I'm not going to turn my video on so I don't lose the meeting.
Okay, great. Okay, let's go ahead. We got a quorum present. Let's go ahead and start the meeting. 3:04. Lisa, you want to start the recording? Please?
I have it set to automatically go so that if I'm not here,
Automatically? Okay.
still records.
Okay, perfect. Okay, let's do roll call. Valerie Richards said she is going to be a little bit late. Oh, I see her. She's here. Valerie, are you here?
Hi, I'm here. Yep.
Okay, perfect. Okay, Linda Winstanley,
Here.
Julia Weinberg,
Here.
Grant North. Grant's here. Grant, can you hear us?
Here, yeah, sorry, turned off my
Okay,
mic.
there you go. Linda Whitney. I do not see her. Miranda.
I'm here.
Okay. Amber Bowman. I do not see Amber. Okay, we'll scoot on. Seamus has an excused absence today. Let's move on. Commissioner Thompson. Thought I saw her.
I thought I saw and maybe she was
She
a different
was.
email. I thought she said she wasn't gonna be able to make it. Was that
Okay.
an email for this meeting?
I didn't.
I saw that email too, but I didn't know if it was for this
Yeah.
meeting.
Yeah, okay.
Okay. Jill Quackenbush.
Jill
I
has
don't
another
see-
meeting that ran over, but as soon as she's off that one, she'll jump in.
Perfect. Lisa, you're here. Monica, you're here. Shira. Shira's here. I see you. Thank you. I don't believe we have any guests. So we will move on to the. You will notice that there is no approval of the last month's minutes, and that's because Lisa approached me to see if it was okay if we did not take minutes, because this meeting is recorded and it is posted on the county website. So if anybody wants to see, get it off the county website. That way we're not duplicating needlessly. So we will go on to the agenda. Anybody have any changes or additions to today's agenda? If not, I need a motion to approve the agenda as is.
I'll move that we approve the agenda as presented.
Okay, second,
I'll second it.
and all in favor?
Aye.
Aye.
I,
Opposed? Okay, the agenda has passed as is. I don't believe we have any full update, and I'll turn it over to Lisa.
Trying to find my mute button. So I just wanted to report that Grant was approved at a recent Board of County Commissioners meeting to continue to sit on the HSAC Human Services Advisory Council. And so he's officially still a member. And then the advertising for the new member update that has been being advertised. I haven't gotten any submissions yet. And so I'll double check after this meeting to make sure that it's still open. But if you guys want to go out and let people know, it was put in the bulletin as far as I think I saw it in the bulletin, and it's been open on the website. And so, yeah, help us spread the word so that you guys can get another member in place of Kirsten.
Great. Thanks, Lisa. Welcome back, Grant. You haven't gone anywhere, but congratulations.
yeah, thank you.
Okay, let's move on to new business. Administrative process update. This is a new one. I'm going to let Lisa turn it back over to Lisa again and let her explain what's going on with this.
Yeah, so I was just going at the administrative process update was just me making sure that you guys understood that we were planning on not taking minutes anymore, but that we will be posting the recording regularly. I can follow up, Linda, about the downloading part to make sure that we have that answered. Did anyone else have answer or questions that I could maybe answer about that, or any confusion?
How long does it typically take to get on the website, the county website? Lisa?
I can usually do it within a week, and it's kind of a newer process, putting those on, but.
I have a quick
Okay.
question, Lisa. This is just kind of like a procedural question. Because you do make it so that it records like prior to the meeting starting. Do you go and edit it so like it doesn't actually post except for like when the meeting started?
Yeah, I watch it through, and if there's something that happens where it like starts really early, like I think this one might have started kind of early because it's showing me that it's been recording for 27 minutes. Or if it goes late for some reason, then I do ask Andrew when he posts it on Facebook to cut it, or on YouTube to cut it shorter. But for a while it like wasn't starting to record, and so once I set it to automatically record, I was able to like more consistently get a full recording of the meeting. But we can also, if that's not working, we can talk about me manually trying to get it to record again.
And I
Okay.
just wanted to share, it was already mentioned in the beginning, but this is just kind of, taking the minutes is kind of duplicative of the process since we're already recording it. And so a lot of our committee meetings have gone to this methodology because then it also kind of helps. There's times where people like said, well, that's not exactly what I said. And so that way we can just say, here's the meeting, you can hear it as it was recorded, so.
Great. Okay. All right. Thank you, Lisa and Monica. Any comments for Lisa or Monica on this? Questions? Okay. Let's move on to old business, Care Oregon policy update. And I'm going to turn this one back over to Monica or Lisa on this one.
You guys just asked at the last meeting for us to talk about this again at this meeting. And so there was the presentation on September 17th. And so and then there was also the letter that I forwarded to you, Randy. And so I put it back on the agenda at your guys' request so that it could be revisited.
So
And so
that letter.
Oh, sorry. I was just gonna say, and so to that point, the letter has been sent to the CPCCO. Just so that way the CPCCO has heard based on what the board wanted to submit and your feedback, they have sent that on.
So I didn't look real close. Was that attached to the agenda notice that you sent out, Lisa? So everybody here on the council has that letter?
That happened after I had sent out the agenda notice. And so I just sent it to you, Randy, and I thought you or us in general might want to talk about it in this meeting. But I can forward that letter to everyone. Should I put that on my to-do?
Yes, please. Is that possible to do right now so people can read it real quick?
Yeah, let me pull it up and I will send it to everyone.
Okay. That way we can let them read it. It's not that long, and see if there's any comments or additions or questions.
Well, and just to remind everybody that when you're asking the board to send something that you're either against or for, the board is going to send their version. And so if you as a HSAC committee, don't like that, I mean, you can share your thoughts and concerns with the board, but ultimately when you're asking the board to submit something as a governing body, they have to come to an agreement as to what they want to send or not
Sure.
send.
Yeah, of course. I personally thought it was great, so I have no negative comments on it or additions or anything. But I just thought it would be nice to have everybody look at it and see what they thought.
And then also, I don't know if you guys were watching the presentation on the 17th, but that is also available on the website as a recording. And it was a presentation from Columbia Pacific CCO about Care Oregon's policy. They're a part of Care Oregon and Shira. And so that I thought that was something that would be very applicable if members wanted to watch it.
Has it sent out yet, Lisa?
Yes, I sent it a couple of minutes ago.
Okay. Has everybody got a chance to see it and read it? Are you reading?
So the one we got's from Mark Quilla, right? That's the one we're looking at?
Yes.
Yeah,
Yes, correct.
just for you all to have an understanding of a board letter process, when we're trying to send out a letter again for or against something, we're sending it out to the entire board to get their feedback on. If we get consensus, if we get feedback from every board member that is in agreement, then we will send it with each board member's name listed. If we aren't able to get responses back in a timely manner, or if there's a board member that doesn't necessarily agree, then we send it on, if we have majority, we send it on behalf of the board, and it just has the board chair's signature.
Thanks for clarification on that, Monica. So
I think
let me know.
I think it says what we wanted to say, doesn't it? It sounds.
Yeah, I think so. Yeah.
Okay. Mhm.
I wanted
And
just a
Julia?
minute to look at it closer, but
Okay.
I don't know where Amber is, and I wish she was here because
Yeah.
there was a statement made in the presentation that this will only affect 11 children in Clatsop County, and it affected, for me personally, 5, and for Amber many more than that, and so, and other people I know also. So we're really questioning that number of 11. And Commissioner Thompson made a comment at toward the end, that maybe somebody could come to our committee and explain that number to us. And that would be helpful.
Well, that's not gonna be, and I haven't had a conversation with Commissioner Thompson. That would be dependent on Care Oregon coming because it's their data. And so staff isn't gonna come and present on
I
that data.
think it was some data that, no, definitely not staff. I think it was some data maybe that somebody from CBH presented. I'd have to,
That was
look at-
all Care Oregon data.
okay. That would be interesting where they got that number from.
Monica, is there
Lisa, oh, go ahead, Linda.
is there somebody from Care Oregon that could present to us? Do you think they probably have a PR person or
Or
somebody?
whoever it was that was there.
That's what I was just going to ask Lisa or Monica if we could get, maybe Lisa could get someone from Care Oregon to present in the future on this.
We can ask, but we can't.
Sure. Yeah, no, I know. But it doesn't hurt to ask. And it'd be nice if we could have someone explain, give us a little more in-depth explanation on this. So.
And I'm looking at this letter more closely.
Grant, your take?
Grant, you're muted.
Grant, you're muted.
Thank you. Sorry. It looks like
Yeah.
it's got in there what we wanted to say right off the bat. I'm sure there'll be some other comments when other people read it and we get further along.
Okay. Valerie, Miranda, do you have any comments?
I do not.
Okay.
I would hope that somebody could maybe look into this a little bit more for our county to get a more accurate number. Since we know it's at least double that. Double the 11 that they presented.
So that 11, Julia, is that through CBH and not counting providers like yourself and Amber?
It
So,
shouldn't have affected CBH. It's private practice.
okay. So where did the 11 come
Hey.
from outside?
Randy.
Where'd the 11? Go ahead.
Sorry to interrupt. I had a work emergency thing and I'm driving, so I'm listening, but I can't look at the letter to comment right now.
Okay. So help me out on the 11. So you said you had 5, Julia, and Amber has a few more. Where did the
Many
original
more,
number?
at least double. It was a number that was presented during the presentation, and I thought Amber would be here, so I didn't go back and look at it more closely.
Okay. Yeah, I missed getting on there and to watch that meeting. I was going to try to do it before today's meeting, but I haven't had a chance. So, okay.
Yeah,
I can't,
yeah.
this is, sorry, it's Miranda. I also can't look at the letter at this very moment. What is the 11 number? Are we talking about clients? What is the 11?
I think it said number of children affected by this policy change.
Okay.
It's
Yeah,
not
I
included in
also
the
don't
letter. It
agree.
was in the presentation.
Right.
I would like
Okay,
to
got
see
it.
a more accurate number included in the letter. Or at
The,
least,
the letter is not going to change. I just want to make that clear. This letter has already been sent. What the board wanted to send has been sent.
Monica, do you
Okay.
know
I-
who presented?
I guess I'm misstating that. I would like somehow to communicate with the commissioners that there is a more accurate number in our county.
And staff isn't going to comment on that because it's not our data. That's not the work that we do. And so that would need to come from Care Oregon,
Or
CPCCO.
could it come from our committee?
Could it come from Commissioner Thompson? Would she?
Or could it
How
come from,
is your committee going to know the CPCCO's data?
it's not going to know CPCCO's data. It's going to know the actual data from private practice clinicians in this area.
You all are welcome to share with the board your comments and concerns. If you all want to put together a letter or anything like that, you're welcome to send that to the board. You're also welcome to, provide public comments, send them emails. So anything that your board wants to, or your committee wants to send to the board, you're welcome to do so. I know Shira had her hand up. I don't know if she wants to.
Yep, Shira.
It might be helpful for the committee to know, and it's not our data either. And so I don't know, Julia, like where the discrepancy comes from. But obviously CPCCO is the Medicaid provider for the region. And so they have claims data and data for anyone who's enrolled in Medicaid with a diagnosis. They have that age, they have the enrollment numbers, they're the insurance carrier for all Medicaid clients in our region. So they are the data holder for impacted patients in the area. So again, I'm just sharing that for the group to know kind of why they're the ones that would be the people to pull this data. I don't know where the discrepancy comes from.
Okay, and I'm saying 5 clients that I was seeing last week, I cannot see this week. Amber has significantly more clients. We can see them, we just can't get paid by OHP. So that's a decision we all have to make also.
That's
And
a tough decision to make.
There's other private practice clinicians in the area also.
So Julia, I have a question for you. The other clinicians in the area, is that something that you would be able to get access to and chat with them and see how many each one, the clients they have that are being affected by this, or we can get maybe a grand total for this county? Is that possible?
I think Amber might have a more accurate number. It's possible it would be hard to, get I guess we could call every clinician and ask them. I don't know if you ever tried to get it there. It was to call you back.
How many? I don't know.
We could do our best.
How many clinicians are there in Clatsop County? Are you aware? Do you know?
I don't know, Shira, do you know?
Shira?
Practice clinicians?
I think your challenge here is that the clinicians who serve the region are not necessarily people who are members of our community. So there are people who live all across the state who are serving people who had been up until yesterday.
And most likely children are in person though. most likely.
I just don't, I have no idea. And I don't, again, I think CPCCO is the only place that is really going to be able to record that data. Because they're the ones getting the claims from the clinicians. So it would be hard to like call everyone just because they live here. You're just going to miss people, I guess.
Yeah, it'd
Yeah.
be really hard to get, but I can take the ones I know and we can come up with that number, which I know is greater than 11, at least by double. I would really
Yeah,
be
if you could-
curious where
if you-
they got their number from.
Yeah. Lisa, maybe if we can't get someone to present to us, maybe how about them writing a letter to our council and clarifying a little more on this?
Yeah, maybe if we can, and I'll ask Monica too, after this meeting, if we can figure out who it is that we would want to make that request to, then maybe if they're not able to do the presentation, then you could let us know as the chair, what it is, the question is that you would like them to answer, and we can request if they could do just that, if they could write a response to the question for us. I would want to make
Okay.
sure that you were the one that told me what your question was, though, so that it was representative of exactly what you guys are looking for, though.
I can
Amber,
work with Amber
What-
to come up with a specific question.
let's refer back to Amber.
I can work with her. Yeah, we can work together.
Yeah,
Her
Okay,
office is
that'd be
right
great.
next to mine. It's very convenient.
I'll follow up
Okay.
with you afterwards, Randy, after I figure out who the person would be that we're gonna make that request to.
okay, that'd be great. And Amber and I have been in contact recently, so Julia, maybe you and Amber and I can keep in contact about that,
Definitely.
and we can come up with a letter.
Yes.
Okay, great. All right. Is that it on the Care Oregon for now? If so, let's,
Randy, I just kind of want to get us, so the way, I don't know if you guys all know how Care Oregon works. So the federal government sends the Medicaid dollars to Oregon. And then Oregon distributes the Medicaid dollars to these CCOs. And I'm thinking there's around 7 in the state. I don't know if that's a definite number. And so Care Oregon is the CCO for Tillamook, Clatsop, and Columbia County.
Mhm.
And so they distribute those Medicaid dollars, and then our behavioral side is Shira at the Shira, I've lost your name anyway. Classic Behavioral Health, CBH, and so to me they would want to come and present, and I might be wrong, but it's important for them to keep our community happy, or because they get the dollars from the federal government and then they distribute them. So it's pretty profitable for them right now, even though the dollars are being cut, the federal dollars are being cut. And that's why we're seeing all this. But I'd be surprised if they didn't send somebody over just to talk to us. I could be wrong, but I'd be surprised if they didn't. Go ahead. Is it okay if Shira speaks?
Yep, Shira.
I was just curious, Linda, what you mean by it's profitable for whom? For whom?
Well, what happened during COVID is people weren't going to see the doctor, so they get so much money per member, and there were a lot more. OHP was expanded. You can make more money and get on OHP. So that's and I could be wrong, Shira, but my understanding is that's why the extra dollars for housing, because they had these extra, because they were getting money for membership. There were more members and fewer people were going to doctors. But right now we know more people are going to doctors because things they were waiting on during COVID, they're going doctors now. So unless I'm wrong, but this is the way the healthcare seems to be going, and all the insurance companies are feeling the crunch right now for that reason. So that's why the housing dollars have been cut back, and these providers that were getting dollars are not. Am I wrong?
I mean, I don't want to speak as the expert on this, as again, I'm not a representative of a CCO. I will say that all of the CCOs across the state, at least 95% of them are underwater currently. And what you're speaking to, Linda, is that utilization during the pandemic went down. And so their reserves went up and they were able to build out the behavioral system of care in a more robust way than we have seen before. Some of those dollars included housing, among other things. Utilization has since skyrocketed. Also, Medicaid isn't just funded by the feds, it's a match with the state. The state also contributes greatly to Medicaid dollars. The amount of money that the CCOs has currently is not enough to cover the behavioral health system across the state. That's Care Oregon and Pacific Source, among others. So they're laying staff off, they're cutting provider rates, they're cutting contracts with anchor providers across the state. So this policy decision, while it has it has everything to do with what Rachel referred to in her presentation, also has much to do with funding and allocation of resources. And the CCOs have a contractual and a necessary obligation to fund the safety net providers in our communities, which are the community mental health programs. And in the absence of a plethora of resources, they have to make tough decisions about where dollars are going to go. And I think that that's some of what they're facing.
And I would also just like to add to that. So Clatsop County, some counties throughout the state choose to be the CMHP. Clatsop County chooses not to. We contract with CBH to act as our CMHP. And so there was a previous comment that, you know, CBH is a conflict of interest because they stand to make money off of this. And something else that is important for everyone to understand is that CBH just they're capitated. They cannot bill more. They receive an allocation from the CCO that is the amount, whether they have, you know, more clients because of this or not, their amount does not change. And by their amount, I mean the county's amount. And so I just want that to also be understood, that there is not some big cash flow that will be seen by CBH because of this.
And thank you, Monica. And to add to that, like, so the number that we saw in the presentation is that roughly 200 people in the community have been getting services from folks in private practice. Hypothetically, if half of those people came over to CBH and I had 100 additional clients that needed care, I'm not getting funding for additional providers to render those services, though my organization will be expected to pick up the care that's needed for those people, and we're happy to do so. But I just wanted to reiterate what Monica's saying, and that CBH has no financial gain. And if anything, we'll just have additional people to care for with fixed resources.
And
Right,
Sharon,
Miranda has her hand up. She's had her hand up for
Yeah,
a while.
I just wanted to, yeah, it's okay. I just wanted to say, as one of those private paid practitioners in the community who wasn't Care Oregon clients until yesterday, Care Oregon is the only CCO and the only insurance, to my knowledge, that paid out of credentialed or contracted providers for services. So I think for me, as I understand that clients are losing providers and other providers are having to absorb those, like CBH, we Care Oregon gave permission to see people out of contract and was paying us. And I think that that's something that we were grateful for the clients, grateful for, but they're the only provider that I know of, and I'm contracted with many, who would allow you to see a client out of contract. So for me, I feel like there's a lot of time being spent on this that is not the best use of our time. And that's because this is something that was an additional awesome thing, but now it's getting reeled back in, as it is with every other provider. And we're lucky to still be having Care Oregon in our area, or in our case, Columbia Pacific, because there's counties there that the CCO is pulling out of completely right now because of the funding. So Eugene, Wayne County, Springfield, Pacific Source is pulling out of there. They're going to have a new CCO because all those providers just aren't going to have a Medicaid provider at this point until it's decided who the new one is to provide services. So that's just my 2 cents.
Julia.
I do get paid out in network. I mean, the client can get paid out in network for almost all the commercial plans. There is an issue with individual plan or group plan, but there is out in network benefits. Shira, my question.
Yes, but that's very different than contracted.
Okay, but it's still getting paid by insurance. Shira, my question for you, my concern is for the clients, is that it's my understanding that you already have a waiting list, that a client, how soon could a client be seen if they come over to CBH?
We don't have a waiting list, no. And I'm making staffing and resource allocation decisions to meet the community need, and the community need that I anticipate will be coming our way given these recent policy changes. So I've actually just added 2 additional adult outpatient clinicians to my adult team to help with absorbing what I see as a potential need. As we've talked about before, CBH has 2 rapid access clinics in the community. So we offer same day assessments for anybody who wants to walk into our clinic in Seaside or Astoria, 8 to 5, Monday through Friday. And they can receive outpatient services in those clinics for up to 45 days before getting transferred to a regular outpatient adult clinician. Or if they're ready to get transferred immediately, they can do so as well. But we don't have wait lists.
What about for children?
We don't have wait lists for kids either. We have capacity in our wraparound program, our intensive in-home behavioral health program, our adult outpatient, just kid services, as well as psychiatry.
Okay,
And I do just, sorry, go ahead, Julie.
I'm getting parents that are saying they can't be seen there because they're being told they can't get in right now. So I will ask for more information when I hear that.
I do also just want to add that something else that Rachel spoke to, and I know Miranda has her hand up, but that something else that Rachel spoke to during the presentation is this is not like a one and done thing. And so they're going to continue to evaluate the need. And so one of the things that I know Amber had brought up is, those clinicians who see neurodivergent clients. And those are things that they're going to continue to look at as far as the need that they're hearing from the different regions. And if they are having to add additional or have additional contracts with additional clinicians who can provide those unique supports that certain clients might need.
So Monica, would
Okay.
we be a group that could express those needs, or where would they get that information?
That's based on, and I don't know, Shira might be able to speak to it better, but that's based on as far as what the billing and the Medicaid system, as far as what they're hearing from the clinicians and the services that their clients are needing. Is that correct, Shira?
Yeah, and I mean, they're also like happy to walk through, from what I'm hearing, like the process with clinicians who are licensed to walk through that COA process. And I know that they are invested in making sure that we have specialized providers who are offering services to specific populations that need specialized care. And I also just want to say, like, I support our private practice community. I support a diverse array of providers in this community that render services to everyone who lives here. Again, these are not CBH's policy decisions. I wanted to make sure that I was giving some of the larger picture around sort of what the financial challenges in the state are currently. CBH is going to take a cut from Care Oregon this year as well. And we're just in a time of retrenchment, like just financially speaking. Oregon isn't in a great place, and we haven't started to experience the Medicaid cuts that will come next year. So, I just want to acknowledge that the CCOs and the state are having to make some really challenging choices, which are also being passed down to organizations like mine, who are having to make some challenging choices.
Sherry, I appreciate you saying that. And I think all the private practice people that I know that I talk to, the concern is for enough therapists to meet the demand of the calls that we get every day. And everyone's challenge with that was before, even more now. And so OHP did ask me to apply. I made a business decision that there was just things I'd need, like an employee handbook and some things that were just beyond what would make sense for me, because I can get enough clients without having OHP, but I feel like I want to serve, the clients that have OHP. So it's hard for that reason, but the issue is bigger. You are right. It's bigger than Clatsop County. It's bigger than Oregon. It's bigger than, yes, it's big.
Mm-hmm.
Having enough therapists, and it will be interesting what happens now with all the insurance issues going on.
Yeah, I think what's most important is that this committee and our community continue to have like meaningful conversations about how to meet the need with limited resources. And I, you as a group get to advocate for whatever policy changes you decide to advocate for. And, just to kind of reiterate what Miranda was saying, like these are statewide, these are big decisions that are happening across the board. So and then I just also wanted to add the element of like, there's lots of ways to think about equity in regards to these policy changes. Organizations like mine, who are certificate of approval agencies, we go through erroneous auditing processes and COA processes to ensure accountability and quality of care and data submission and employee handbooks and all of the things that are required to make sure that we're operating at a certain standard in order to be reimbursed by Medicaid. And so for much time, folks in private practice have been able to be reimbursed for Medicaid without having to meet the same standards that organizations like mine have to meet. And so there's also a discrepancy there that I think Care Oregon and the CCOs are trying to remedy.
Okay. All right. Thank you. Any other comments or questions here? It's a lively discussion. Okay. Shira, you're up.
Let me get my notes. Okay. Just an update on Baker Building, which is our 32 units of permanent supported housing in Astoria that's set to open in December. We're just on track for that, and we haven't experienced a whole lot of construction related problems. So that's exciting, and we're excited to see the impact that this new building has on our community. So that's good news. Like I mentioned before, I just want to reiterate that we have drop-in, walk-in. It works like an urgent care services available at our clinic in Seaside on Broadway, and our clinic in Astoria on Bond for adults who need same-day access to substance use disorder or mental health treatment. We're having some challenges with a population mix at our Seaside clinic, just with youth who were coming in to receive care there and having it serve as an urgent care for adults. So we're opening another clinic space down in Seaside that I should have had the address ready for, and I don't, but I can send that out to you all. And that opens next week, and it's specifically for kids who are receiving outpatient services, so that we can try to kind of limit the population mix of adults who are experiencing an urgent clinical need and kids who are coming in for care. So we're excited about having additional office space down there in South County. We've talked about this in here before, but just to reiterate that CBH is working with the county on expanding services for substance use disorder treatment in our schools. Astoria School District has been really engaged in this process. So we're starting off with them, and we have scheduled meetings with Seaside School District and Napa in the coming weeks to talk about operationalizing those services in those schools as well. So that's good progress. And then I just had a general note here, which I feel like we've really covered, which is just our current financial climate, and that CBH is also leaning out. We're not in any kind of place of layoffs or anything like that, but I am making some structural staffing decisions and having to cut positions where I can, and moving people into critical service positions where I can, because our funding is not what it needs to be to continue at the same level of service that we've been at. So, questions about that?
Okay, no questions. Thanks, Shira. Appreciate
Not
it.
a question, just I'm glad there's going to be another clinic for children. That's great. And
Mhm.
isn't there
Yeah.
now a clinician at the school also?
Yes, so we have mental health clinicians in all the schools throughout the county. They're located in the high schools for the most part. And yes, but now we're going to have an actual clinic in Seaside where kids can receive outpatient care. We have our Upper Town Clinic in Astoria. That's a beautiful space. If you haven't been in there, you should stop by. It's right next to the VA clinic, next to Safeway, and kids can receive care in an outpatient setting there. But as you all know, Seaside is far from Astoria. So we're excited to have some space in South County too.
Hey, Shira, when
Mhm.
you get a chance, could you send the address to
Yep.
us as a council, so we have
Drop it in
that?
the chat. Yep.
Thank you. Appreciate it.
Mm-hmm.
Okay. If not, we'll move on to county reports, and Commissioner Thompson is not here, so we'll move on to Monica.
Thanks, Randy. I am just going to try and share my screen really quick. As Shira mentioned, we're working on the opioid settlement side of things, getting the youth. And so we've signed that contract with CBH. But something else that we have been continuing to work on, and CBH is a partner in this as well, is the deflection program, which has come before you all before. We did receive today just kind of a 1-year stats, because we started this in September of 2024. And so I'm assuming what is up on my screen you can all see, which is the deflection stats. Okay, so overall in the past year, we've offered this program to 51 people, and we've had 35 who have entered the program. And we have had 10 graduations. This next Monday, we will see 3 more graduates through the program. And so we're continuing to look at pathways that people can enter the program for. And one of the ones that is being worked on now is through first responders emergency services. And so, there are times that our police, or sorry, not police, because they're already a pathway, but fire and medics respond to calls of overdose. And when those overdose opportunities are available, because they're able to revitalize the person and reverse the overdose, then they're another pathway that can offer the deflection program to these individuals. And so we're continuing to try and figure out ways that we can expand the program. One of the things that we do have is our most popular, or I don't know if that's the right word, but the largest number of people that we have interactions with, as far as the people who enter the program or the people who decline the program, continue to be in that 30 to 49 range of age group. And then these are the variety of drug types that we continue to see. And so meth and fentanyl by far are the largest amounts that are being utilized or found when they have these drugs on them. So I just wanted to give you all an update of where things are at, because we're a year into this program. Super proud of the Clatsop County Sheriff's Office as well as CBH because we continue to be an example of a good deflection program and the work that they all do to try and continue to improve it and to try and continue to get folks engaged. And so that is all that I have. Oh, and
Okay.
sorry, I do have one more thing. We are excited because we've been waiting for more than 3 months now to get contracts from the state, and I received an email today that I'm supposed to be getting a contract for us to review to provide shelter funds to our shelter beds that were created in the last biennium, as well as continuing to support Helping Hands and the Harbor, which were existing beds prior to the creation of the lifeboat and CCA beds. And so just so you're all aware, those shelters have been continuing to operate despite not getting any funds from the state for that since June 30th of 2025. So we're hoping to get those contracts signed soon and get those folks reimbursed.
Okay. Good news. Any questions or comments for Monica?
I just wanted to say I used to volunteer at the old jail and now I volunteer at the new jail, and it's such a different atmosphere. It's so positive at the new jail and the inmates. It's just, yeah, it's really good, Monica. I'm amazed the difference. Yeah.
Well, I give, obviously credit all goes to the sheriff and his team out there. They worked really hard to have an improved environment.
Yeah, it's really good.
Yeah, good news. Great news. Any more comments or questions for Monica? If not, we'll move on to public health, and Jill is not here. So Lisa, you're up again.
Jill's
Got anything
here.
for us?
I'm here. Jill's here.
Okay, Jill.
So just a few updates for you. One, there might be questions around federal updates and how that's impacting public health, specifically WIC, and to let folks know that business as usual for WIC. The OHA has confirmed that the current plan is that WIC will continue to function through at least mid-October. And then as the feds continue to do what they're doing, they will reassess at that time. So at this point, business as usual. So please keep, referring folks to WIC, and we're still offering the same level of services with WIC. And then our community health needs assessment, we are wrapping up that. So we're getting to the end pieces, and we'll be excited to share that out. And next steps, once the assessment is completed, is working with the Rural Health, Rural Health Coalition and community partners around a community, or with our community health improvement plan, I'm sorry, the community health. Why am I blanking? Help me out, Skylar. Our implementation. I'm totally having a brain.
Well, now I can't remember it either, but it's a chip. You do the CHA and then you write the chip.
I was gonna say it's the chip.
It's the chip. Community health.
And I thought it was
improvement plan. It's the implementation
I think it's an improvement plan.
I think
it's an improvement plan.
Well, the chip.
It's a chip.
We'll work on the chip. And then the other, and I don't have it pulled up right now, so I can pull my calendar up, but just to make sure that everybody is aware of the roadshow that the Alcohol and Drug Policy Committee is doing, and they will be in Tillamook coming in a week or so. And just highly encourage folks that are able to travel to participate in that.
Okay. Any questions or Jill, I apologize. I didn't see you come in, so
That's
my
okay.
apologies.
That's okay.
So I have a question, I'm
not-
sorry, Randy. So the Sharps
Go ahead.
program, I thought I'd heard that wasn't getting funded. Did you guys lose funding on the needle program, the needle exchange?
Oh, our syringe exchange program.
Yeah,
We have funding for all of our harm reduction programs through burn. But the Columbia Pacific CCO, with decisions that they've been having to make, we did get notified, and Lisa can talk to that a little bit more, but we were notified that they would be no longer funding the syringe exchange harm reduction program. And, you know, they were one of our first funders when that program was just getting started, so.
but you have it funded under a different program now? Is that what you said?
We do have some other funding. We don't have funding to replace the funding that we were getting from the CCO. So we are also having to make budget decisions around how we will be going forward. We do have some carryover this year that is going to help us get through this fiscal year, but we will have to be looking at how we were going to implement the program with the reduction in resources next year. Is that correct, Lisa?
Yeah, it's braided funding sources, and the grant ends on the end of December, but we do have enough carryover, and those aren't the type of funds where we have to give them back if we haven't used them. So we'll continue to use that carryover for the rest of the fiscal year. So we'll be good through June 30th, 2026. And then we'll have continued partial funding after that. So it's not that we won't have any funding for next year. We just won't have that 70,000 that we usually get or we've gotten in the past.
Thanks.
Okay. All right. Any questions or comments for Jill? All right. If not, let's move on to Lisa.
So I forgot to mention any of our outreach efforts at the last meeting. So I'm going to go all the way back into August. We had Overdose Awareness Day that was at the end of August, and CBH came to that, and it was a candlelit vigil that was under the bridge in the park, and I thought it was a really meaningful event, and I really appreciated having CBH, and there was the Alki Angels there too, and some community members. And so that I was really glad that we had that. We also went to the Aging Welfare, and we're going to be coming in November. We're going to go to the Stand Down event, which is a veterans and military service event as well. And we're kind of we usually bring our whole everything to those. So we have naloxone, and we talk about all of our prevention programs, problem gambling, suicide prevention, alcohol and drug prevention, tobacco prevention, and we give out naloxone and bring information about our harm reduction program. And then if it's child focused, we bring some stuff about WIC and immunization. So it's kind of the end of I'm sure there's be more outreach, but we've had a lot of outreach this summer. We went to Regatta as well, and we did 2 events at the same time for Regatta weekend, also in Astoria. And then I'll just talk about our assessments as well. So we have the Youth Prevention Needs Assessment, and you might see on the agenda, but I'm wondering if maybe we could present that to you next month, because we're just finishing up the report right now for that. I don't know how Jill feels about it, but we could maybe even present it kind of with the Community Health Needs Assessment, and then we could talk specifically about the Youth Prevention Needs Assessment, or maybe, I don't know, maybe those should be 2 separate, but those 2 assessments are both kind of finishing up around the same time, and it would be great to talk to you guys about both of them. And then the data capacity assessment is kind of starting after that, because we're looking at what kind of data from the Community Health Needs Assessment and the Youth Prevention Needs Assessment that we needed and that we had and that we were trying to get from from partners and from different systems that we access. And then we're going to build off of that and see what our community partners need for data, what kind of capacity they have, what capacity we have and need in our department. And the focus of that as kind of an example of public health data will be substance use data. And we're doing that with funds received specifically from opioid settlement funds that were received for alcohol and drug prevention. But it's really tied in with all of our substance use prevention programming, so overdose prevention and those ones as well. And I would love it if in December we could use this group as a focus group to give us feedback on what kind of, data and information it is that you guys have access to, wish you had access to, understand, don't understand and want more information. And we could have our contractor come to the December meeting and it would take up most of the meeting. It would be probably about an hour of the meeting, and they would get your ideas and information to make sure it was included in that data capacity assessment.
I think it's a good idea. I support that. I also support you and Jill presenting at our next meeting. So what does everybody else think on the council?
Yeah, but Lisa, I'd want to know, like our council, are we focusing on what our council focuses on? Because some of us, like I have a big thing for seniors, but it's not necessarily what the council focuses on, more maybe the mental health side, or would you give us a list of kind of what we see in these categories, I guess?
I think that with the focus groups and kind of like when we're gathering information, we want information from people holistically. So your view as members of this council is valuable, but also your view as a community member or as someone who works with senior citizens, that's equally valuable. So we would just want you to come and answer the questions holistically with your points of view. You wouldn't need to worry about, because this group, part of your role is giving us feedback on our prevention programs, and this data capacity assessment is part of us assessing our programs and creating those priorities. And so, yeah, you wouldn't have to think too hard about it. It would just be your thoughts and ideas.
Thank you.
And so for the rest of the council, the data assessment focus group would take up most, if not all, of our time allotted in December. Is that when we're going to do that? December? Yeah, December. And we would have to skip the provider reports, but we're not, according to our bylaws, it would be okay because we're only required to meet at least 4 times a year. And so skipping 1 month of reports is not going to be a big deal.
And then Randy, since I think you can't see Jill, she had her hand up.
Oh, go ahead, Jill.
Yeah, and I don't really need to add too much because I think, Lisa, you got to what I wanted to say, but to kind of also put the data capacity assessment into context with public health modernization, if that's a term that you've heard. So a foundational requirement of local public health departments is to be able to provide epidemiology and assessment and data analysis to the community and support the community in that. So part of this assessment is really looking at what is our local public health department's ability and capacity and capability to meet the needs of the community so that it will help us, again, with the community health improvement plan, know where some places where we might need to focus. So I, like to Linda's point, I would say definitely we want to hear it all. We need that feedback.
Thanks.
Okay. So I would say if nobody else is opposed to it, go ahead and put that data assessment on the December agenda, Lisa. And also for you and Jill to present at our next meeting on your focus.
Perfect. And then I also was going to offer that I could put together a presentation on roles and responsibilities, but it seems like next month and the month after will be pretty packed. So maybe in the new year, should we look at having a presentation? Just because we've talked about a few times roles and responsibilities, but we've talked about it in the context of a specific issue. But I think that it might even be good just once a year to have kind of like a revisiting any updates, anything new, reminders to members who have been here for a while, new members get an overview of what the process is around the roles and responsibilities for HSAC is, so that we make sure we're all on the same page, and so we can have those conversations not connected with a specific issue. So then when there is something that you guys really want to give feedback on or have some sort of involvement or activity, it's like we're all kind of in the same place when we start talking about that.
Yes, I think that's a good idea, Lisa. Also, maybe at the same time, we can put on the agenda to review the bylaws again. I know we've done this in the past every so often, and they've been amended quite a few times over the years. Maybe it's a good time to revisit that and see if everything still looks good for our council.
Yeah, that sounds good. Yeah, just if we do that once a year, maybe it can become like a regular January thing.
Sure. Great idea.
And then as part of the data thing, I was also just going to highlight that I've now with the overdose surveillance and response plan, I've been tracking the overdose data using I talked about what our plan was. So that's using data from the medical examiner's office and also data from Essence, which is emergency department data looking at overdoses in our county. And we did have kind of higher, we were in the yellow alert a lot of the time through July and August, which was when I started tracking. And now we've dropped into being mostly green, which is up to one overdose that's going into the as the baseline going into the emergency department. That's a resident of Clatsop County, because so that's not even necessarily at Columbia Memorial or at Providence, although sometimes it is, but that's inclusive of all hospitals in the state that are seeing someone for an overdose related emergency room visit. And so one per week is our baseline, and we've been in green, and then as well as tracking the medical examiner data, we've been in green since the end of August. There's through September, which doesn't mean that we shouldn't worry about anything. I mean, it means that we need to continue that kind of basic messaging, because the trends that we were seeing during that time and that we've seen in the last year is that polysubstance use is really deadly. That we need to be telling that to people. We need to be giving people supplies to test drugs, and to start kind of, if they are going to be using polysubstance use or a new drug that they haven't tried before, like low and slow, and to make sure that we're able to offer people those services, because they're still with us. Because if people have a fatal overdose and they don't have Narcan, or they can't get the services they need, then then they can never be in recovery either.
Okay. Can you hear me?
Yes.
Okay, I'd lost you there for a second. Sorry. Okay.
Randy,
Yes, go ahead, Monica.
sorry, I just wanted to comment on something since Lisa was commenting on the red and green status in the data. At our last deflection meeting, one thing that we now have medics on that deflection team. And one of the things that she commented on in regard to, like, it was showing Clatsop County as going up and the rest of the nation kind of going down. And she said that one thing that obviously you're not going to get in that data is they have a lot of people where oftentimes by the time the first responder responds, the person is no longer there. And so more than likely, the overdose has been reversed. And so there's still a lot of unreported data that isn't getting captured because, when they show up, there's nobody there. And so then they just have to, say that it was, unreported individual or whatever. And so.
Yep, that's a good point. Okay. All right. Any questions or comments for Lisa?
Shira has her hand up.
I mean,
Shira.
just to add to that like Narcan has become a regular part of use for people who use drugs, and so an overdose has become almost like a regular part of use for people who use drugs. And so the number of overdoses that are reported are so significantly under what we know are actually happening out in our community. And so I just wanted to kind of pile on to what Lisa and Monica were saying, and that we're really not going to be able to have accurate data on overdoses because of the degree that people are able to use Narcan, which is great, but really because of the lethality and of the substances that people are using.
Yeah, I think that's a really good point, is talking about the limitations of the data. And I think the emergency department data, it's more kind of like the canary in the coal mine. That's just like a little tiny slice of what's actually happening, but it's a piece that we can see. And so looking at that and using that as like, if there's more people who are going into the ED, and we already know that there's a lot of people, we heard that in harm reduction as well. There's a lot of people who do not call 911 and they're not comfortable with engaging with services. And so we know that all that's happening, but then when we start to see an uptick in EMS and emergency department data as well, then that's a real indication that there is definitely something going on, and we need to pay attention and start looking at trends and try to figure out what that is so that we can change and adapt our messaging. And I think that's a really important point.
Anything else? Any questions or comments? Okay, thanks everyone. We're going to go ahead and adjourn the meeting, and we shall see you again on November 6th. All right, have a good night.
Okay. Thank you, Randy. Bye-bye.
Thank you.